Welcome back. Well, we have two folks here from Genesis Medical Center. We have Dr. Esther Mark and YZ Azar. Thank you both for joining me. It's very nice to meet you.
Thank you.
Thank you for having us.
Now, Genesis Medical Center, tell us a little bit about what the concept is.
I'm the business manager, and Dr. Mark is our clinician at Genesis Medical Center here at near Laguna Woods Village. The things that we cover are basically anti-aging treatments, as well as joint therapy for joint pain, as well as cognitive decline. We help our clients with rejuvenating their senses, specifically to the central nervous system, and we have modalities that will help them achieve that. Okay. And also weight loss and diabetes reversal. These are things that we focus on. And aesthetics, Dr. Mark's an expert in the aesthetic field. Okay. She does Botox, fillers, the IV treatments. Okay. She's very good at that. And those are the things that we cover generally.
Okay, so let's talk about, when you say reversal, I mean, how far can you actually go with these treatments? Can you get an entire reversal of diabetes?
Well, definitely that's the goal. Of course, we have people that are now on insulin, so we have people with type 2. They're affected not only from majority of times from the possible side effects of diabetes, and they're usually overweight, so we help with that. Okay. And with a diet, lifestyle modification, we try to almost like teach them what to do, encourage them to follow the program. Okay. Of course, patients, if they take medications and losing weight allow them to lower the blood sugar, then we can decrease the doses. And if there is a need for, let's say, if patients are especially overweight, we can use a medication as well that has been recently approved by the FDA that is called Ozempic, and it's pretty miraculous drug that we can.
Is that an injection or is
it's
that
an injection?
It
right.
is, okay. But then you're also talking a little bit about a combination, right? I mean, you're talking about weight loss, you're talking about eating well, right, and injections. So what kind of therapy do you put them through beyond what you just mentioned?
Well, again, if the patient is already on treatment, our goal is to, with let's say a couple of medications that we usually use for treating diabetes, our goal is to reduce as much the doses of the medication, maybe hopefully discontinue it. But we coach our patients because we give them a very complete dietary program, but the goal is after the several weeks that the patient needs to be on their own and follow, eliminate the carbs, increase physical activity, focus more in eating good proteins, good vegetables, just for the best, to obtain the best results.
The philosophy is that, there's a lot of yo-yo dieting that happens in society, and we've all heard of all the different diets, but our approach is that we want to have a lifestyle change combined with nutrients from the inside, the food that you eat, the psychology that you have, the exercise that you do. Right. So Dr. Mark combines all these things in a program, and then of course maintenance after. Okay. It's very important. Everyone can lose the weight, but then how do you keep it off? So we have a good program to sustain that, and it's a lifestyle change. It's not something where overnight it's gonna give you a miracle, but it's something which you can sustain and slowly change the lifestyle and achieve that optimal health as we age, as we all age. All right. So that's the philosophy behind that program.
So let's talk a little bit about some of the treatments that you utilize that could potentially help folks with these various types of ailments. You have IV injections. Tell me about that.
IV injections basically involve, nutrients that we would need as any of the vitamins that we take by food, we don't absorb. So the IV, it absorbs it at a much higher percentage and better rate. And you can tell them some of the types of IVs that we offer.
Yeah, the most common protocol that we give for intravenous vitamin administration is called Meyer protocol, that contains all kinds of vitamins from B complex, D, calcium, magnesium, and vitamin C. But then what we can do, we can customize the amount of nutrients that we put inside the saline IV bag to improve the ailment that the patient suffered from. Okay. An example, if a patient has an upper respiratory infection of recent onset, we give higher doses of vitamin C, and it's definitely miraculous. We had lots of cases of lingering COVID, and the treatment is incredible. The results that we had, because people complain of this chronic fatigue, this hair loss, this, feeling low, almost depressed. Our IV treatment has really improved their symptoms.
Well, that's great, and that, like you said, if you're not getting the nutrients from your food, then this is a great supplement to be able to do that with. What are some other things that this treatment can help with?
The IV vitamins from weight loss, from detox from certain medications, to boost immune system, and even for aesthetic purposes. Vitamin C doesn't brighten your skin, besides being excellent for the function of the body.
What about for hormones?
Yeah,
does it help with that too?
Yeah, it could. Okay. That's a little different.
One of Dr. Mark's expertise is hormone balancing that we do for males and females in a very natural way. So that's something where if your hormones aren't balanced properly, then your weight loss will be affected.
Definitely.
Right.
So it's sort of like the basis of your problems, the building block. So she'll do a complete hormone assessment on you as well when you come in.
Okay. Right. All right, perfect. All right, let's talk about some other things that you specialize in. You have anti-aging and rejuvenation, and beyond the IV treatments, you also do Botox and fillers.
Right. We do quite a few aesthetic treatment, not only derma filler, Botox, but we actually use the platelet-rich plasma. They can be injected or used in combination with microneedling to improve the. It gives you a glow and helps regenerating collagen. So sometimes we use it in combination, so we can actually inject everywhere, not only in faces, necks, hands. We combine derma fillers with platelet-rich plasma, and to get the best results. And we do a treatment for hair loss, and we PRP with injection of the scalp at the affected area, and it's extremely successful. We have physicians that refer a patient for after I had a hair transplant, and to keep the follicles going. So natural and amazing treatment, good results.
So when you talk about hair loss, there's a couple different things. So the COVID-19 is people have been experiencing hair loss, but then also there's a thinning of the hair that actually a lot of women have trouble with, where it's right down the middle. Does something like that help?
Yeah, that has to do, you were mentioning hormones. Hormones have a great deal of impact on that.
Okay.
And in women it's more dramatic after menopause and postmenopause, but happens in men as well. Aging affects both of us, men and females, right?
Unfortunately, sometimes it doesn't seem to be as forgiving as some. But all right, excellent. And then now, interesting, you said something about joint health. What do you do for that?
Yeah, so joint therapy, everyone has joint pain as you get older. Inflammation increases in the body. So as your joints get inflamed and you get those aches and pains with aging, the first line therapy is the PRP, which you mentioned, the platelet-rich plasma that gets injected into the joint in lieu of getting cortisone or steroids. There's a lot of studies now. If you look at the University of Chicago, they have a big study that they're replacing corticosteroids with PRP treatment as a first line of treatment for joint pain. So we do that automatically when they come in. If they qualify, Dr. Mark will get you on that joint with PRP treatment, and it's very good, very 90% effective.
Yeah,
it's very good.
Well, there's a lot of folks here who play pickleball and tennis, and we have pain in our knees and our elbow, the big tennis elbow. I have heard of people who have done that instead of surgery.
Right, platelet-rich plasma is. The treatment is good not only for chronic degenerative disease, but for acute injuries as well. Wow. It's been used for a long time, more than 50 years for athletes, and it's a natural treatment, and it's like almost using your own stem cells.
Yeah. All the professional teams, they do it for maintenance.
Right.
Prevents the joint from deterioration as well.
See, that's better then, because I think you can only have so many cortisone shots in your lifetime before it gets
no more than 3 a year, so that's what usually is recommended. Right.
So when someone would like to come see you, do you provide a consultation and kind of figure out what it is that they're looking for?
Yeah, so the process is you just call the number, you say, I want to get a consultation, you come in, you'll see Dr. Mark and her nurse, and they'll sit and go through your whole history.
Okay.
And then they'll come up with a customized treatment for you.
Perfect.
Yeah.
Perfect. Anything else that I might have missed?
We also have male and female sexual and health enhancement and treatment.
Okay.
And that's something that's up and coming. And a a lot of males come in for that, and
Okay.
they're very satisfied.
Okay.
They can come in for a free consultation for that as well.
Perfect.
Females as well. We have treatments where they want to feel young and rejuvenated, and we have protocols for that as well. And Dr. Mark is very good at that.
Yeah.
Excellent. Well, thank you
Yeah.
so much for the information.
Thank you.
I appreciate it.
Thank you.
Thank you for having us.
Thank you,
Appreciate
Lisa.
it.
You're welcome. If you want more information about any of the things that we have discussed, you can always go to their website, which is genesismedicalcenter.com, or you can call them on the screen for a consultation. We'll be right back.